Okay, this is Siobhan, and she's called us today because she has a blood nose. So, Siobhan, before we start, I'd just like to assess your bleeding.
Yep. Can I just please have a look?
Okay. So we're assessing to make sure there's no trauma and to estimate what the bleeding's like, and if there was trauma, we'd be looking for hematomas. Okay, so what I'm going to get you to do is, could you just lean forward and I'll get you to pinch the soft part of your nose. Okay, awesome. While you do that, I'll ask you some questions and explain what's happening. So, do you have any medical conditions? Are you on any medication? Do you have any allergies?
No.
Okay, awesome. So I'll just explain what's happening for you. You've got blood vessels in your nose, and what we're looking at today is you've got an anterior bleed, which is very common. About 90% of blood noses are related to the septal part of your nose, which is the middle, where the Kieselback plexus is. Sometimes you can get posterior bleeds, but in this case I don't think that's the case because you'd be really gushing with blood and going down the back of your mouth and stuff. So what we're going to do is we're going to wait 15 minutes, and once the 15 minutes is up, if it's still bleeding, we'll give some adrenaline. So also, blood noses are usually caused by a dry nose, or if you hit your nose, or just the capillaries becoming irritated and getting a bit of a bleed. So have you had any trauma?
No.
No, just a nosebleed. Have you had it before?
Yeah.
Yeah, and what happened last time?
I went to the GP because it was a lot of blood. So I thought it wasn't going to stop.
Okay. And so why did you call today?
Just because I didn't want it to be the same.
Okay.
Saturday.
Okay. Okay, so you're just worried and there's no GP open?
Yeah.
Okay, so I'd just like to have a look. Can I reassess that? Okay, we've still got quite a bit of blood, so I'm going to assess that as moderate. So what we're going to do is we're going to give you some adrenaline in each of your nostrils, and what that does is it stimulates alpha and beta receptors, and we want it to stimulate an alpha receptor, which causes constriction in the blood vessels, so they get tight and close a bit.
Does it hurt?
No, it doesn't hurt. I'm very gentle. Okay, so what we're going to do is we're going to get a 10ml syringe, the nasal dispenser, some adrenaline, drawing up needle, and sodium chloride. You right there? Okay, so first of all I'm going to do a drug check. So we've got adrenaline 1 ml, 1 meg and 1 ml, and the first of 21, so that's in date. I'd ask my treatment partner to also do a drug check and check the date. And what we're going to do now is we're going to crack open the vial and put a drawing up needle on.
Can I blow my nose first?
And we're going to draw up the drug first. I'm going to draw up 1 ml. There, out of there. And that'll go in the sharps container. Sharps out, and we're going to draw up 9 ml of sodium chloride, 0.9%, and take that off. Put the nasal dispenser on. We'll ask our patient to blow the nose just to get rid of any blood that's in there. Okay? Yeah. And you have no allergies, so there's no contraindications for it. So what we would do is gently place the little nasal device up your nose and squirt 2 ml into each nostril, and then we're just going to pinch our nose again. Okay? So once we've done that, we can wait another 15 minutes. If the bleeding doesn't stop, then we can administer another dose. And then after the second dose, if it doesn't stop within 20 minutes and it's severely bleeding, we would consider transport to the hospital. We'd assess for hypovolemia, which is your blood pressure dropping and you're going into shock, which is not happening today. And we'd consider TXA 1 gram if there was an issue, and consider backup if we weren't feeling too confident with the thing. And there's also nasal devices available, so rapid rhinos, nasal tampons, and there's various other ones. So I'll just have another look. Can we have another look? Okay, that seems to have stopped, so we're not going to administer any more adrenaline. Before I go, I'm going to give you a little bit of information. So I've just got an advice plan here. So if the bleeding starts again, we want you to see a GP within the next few hours. We'd like you to see a GP, because we've given adrenaline, we'd like you to see a GP within the next 24 hours, just for a check. And I want you to avoid blowing your nose and avoid hot showers and hot drinks. And if the bleeding becomes severe and you're worried, you can always call us back or go to the emergency department. We've also got a number on here for the helpline, so if you're just concerned but you don't know, you can give them a call. So we've got that advice on here. Okay, and things you can do to prevent blood noses is use humidifiers. You can always put a little bit of Vaseline in your nostril just to keep it moist, and just don't stick anything up there, no fingers or anything like that. So before I go, I'm just going to double check my procedures. So we've determined you have a blood nose. We went with mild bleeding, so we compressed for 15 minutes. The bleeding still continued, so we went for moderate. We got you to blow your nose, we've given adrenaline, and we've compressed for another 15 minutes, and it stopped. And I've already explained what would happen if it didn't stop. And I also need to check my non-transport list. So let's tick that off, just to be safe. So our non-transport and pause checklists, we've assured that your vital signs are all okay and they're unremarkable. We've assessed the nose for trauma and we've made sure that we can't see anything that needs attention. You're already immobilising, and you've been informed written and verbally of what has happened and what's going on. Do you have any questions?
Why can't I have a hot drink?
Just because we don't want the vessels in your nose to open up, and with heat you get dilation, so we don't want you to get another blood nose. Okay. And don't blow your nose because we don't want to dislodge that cord. Okay, so you're happy with that? Hey, Siobhan has called in an ambulance for a headache. She thinks it's a migraine. So we're going to do an examination and see how we can help her and rule out any serious causes. So you've got a headache.
Oh, it's more than a headache. My head's throbbing. I can't see out that eye.
Okay.
It's too bright.
Okay. When did it start?
Kind of. I woke up with it, but it's got worse.
Okay. Does anything make it worse? Just the light?
Yeah, just I probably haven't slept well recently, and if I'm stressed, that's when I get more.
Okay. Alrighty. Do you? Sorry, blank mind. What does it feel like? Where is it?
Well, I can't take my hand off, but it's like it's got all that side to the back.
Okay. Is it throbbing or?
Yeah, it feels like throbbing in my eye.
Okay. And you said stress and things bring it on. Does anything make it better?
I have been to the GP before. I just take paracetamol and ibuprofen. I think it's really bad.
Okay. You haven't been sick lately, or any allergy flare-ups?
No, I feel a bit nauseous now, but not sick.
Okay. Do you usually take your pills? So have you taken pills today?
Not today. I've run out.
Oh, okay. So you haven't been and picked up a new script?
No, and I haven't got a car, and I can't go down. I can't walk 2Ks like this.
Oh, okay. Do you have any allergies to anything?
No. Yes. Tramadol.
Oh,
I
okay.
can't take that. But other than that, not allergies.
Okay. Alright. And you're not pregnant and
No.
haven't had a big night out or anything like that?
I wish.
Okay. Is it alright if I have a look?
Yeah.
I just want to have a little feel of your head.
Okay.
Right?
Yep.
So I'm just going to palpate around the temporal lobes. No pain.
Yeah.
And down your neck. Nothing.
No, not too bad. It's alright. It's more inside my head.
Okay. And you haven't, if you move your head around, there's no stiffness?
No.
Can you put your chin on your chest and backwards? Okay. Wriggle your shoulders. Awesome. Okay, so you haven't done anything strenuous lately?
No.
No? And you haven't...
Just work, but I've been just sat at a desk. Maybe too much computer time.
Okay, and you haven't hit your head or anything like that? Okay, so what medication do they usually give you at the doctor's?
Just paracetamol and ibuprofen.
Okay. You're feeling nauseous. Would you like... I'll give you some paracetamol and ibuprofen if you like. And if you like, I can give you something to stop you from feeling sick.
Yeah.
No,
I don't need that.
No?
No, that usually goes away once I've taken it.
Oh, okay. So you just want some pain relief?
Yeah, please.
Okay. So if I give you some pain relief, we can leave you at home if you're happy with that.
Yeah.
Okay. So we'll sort that out. So what I've got is some paracetamol and some ibuprofen. You're less than 80 kgs, is that correct? Sorry, we have to ask. So pill-wise, we're going to give you a gram of paracetamol, which is 2 tablets, and then we're going to give you 400 mg of ibuprofen, which is also 2 tablets.
Yeah.
Okay, we will check the expiry dates, the 9th of 21 and the 7th of 21, paracetamol and ibuprofen. Okay. If you take it yourself, make sure you follow the directions on the box or on the prescription. Alrighty. So, and you had no allergies. Okay. So, with a glass of water, I'd get you to take those. And what paracetamol does is it inhibits, it's an analgesic, and it inhibits the production of prostaglandins. And then ibuprofen also inhibits the production of prostaglandins by interfering with prostaglandin synthesis, and we use that for pain and fever. Okay, so they both help you out. A migraine, just so you know what's happening for you, is just a disturbance of the sensitive structures inside your brain, but it's nothing to.
Yeah, my dad used to get heaps of them. So
Okay.
Okay. Worse.
Oh, so your dad had them too?
Mm.
Okay. Yeah, that's another good indication that is what we are dealing with.
Mm.
So I've given you those pills. I have just an information sheet for you, and that just covers what we've seen today. And we would like you to revisit your GP within 12 hours to get some repeat scripts and maybe review what you're taking. How often do you usually get a migraine?
Not that much, like every few months.
Okay.
Yeah.
Alrighty. So also in the meantime, I'd like you to keep well hydrated.
Yeah.
I'd like you to rest and stay in the dark and away from noises will help.
Yeah.
And take your regular pain relief as soon as you can. I've just given you some, so you can't take any for another 4 hours for the paracetamol and 4 to 6 hours for the ibuprofen.
Are you going to leave some for me to take my next dose?
I would recommend that you go straight to the doctor to get
Okay.
the next dose.
Yeah.
I can probably leave a couple of tablets
Yeah.
with you. If it becomes worse and you're concerned and you experience any 2 or more of these symptoms, you ring us back or go to the emergency department. And if you're worried but you're not sure, you can always call the helpline. There's a number on here. And also just some guidance to try avoid migraines. You can try some, or for pain relief, you can try some relaxation techniques. There's things out in the community like acupuncture and massage and things like that. And just make sure you get enough sleep, don't miss meals, eat a healthy, balanced diet, drink lots of water. And yeah, just basically take care of yourself. Okay?
Yeah.
So you're right if we leave you there? You got no
Yeah.
questions?
No, that's all good.
Okay.
Yeah.
Alrighty.
Yeah. Thank you.
Thanks. Oh, sorry, just before I go, I'm just going to go over my red flags because it's good procedure.
Yeah.
So this book just tells me that there's nothing that's urgent. So my red flags, you've got no head pain or neck pain following my manipulations, so touching around. You've got no neck stiffness. It's not a sudden onset of severe headache. It's a migraine, more gradual. You've got no temperature. You're not persisting to vomit. You've got no focal or neurological signs that are of concern. Your consciousness is quite fine, and no mental status changes, and you haven't had any trauma. You're not taking any coagulants. You're not taking any medication. No signs of temporal arteriosus because you don't have any pain on palpation. You've got no family history of cerebral vascular abnormalities, and it was not set off by sexual activity or exercise, was it? Okay. And headaches associated with seizure, you've got none of them. And you've got no orange flags either, so it's not sinusitis, and the migraine symptoms are just normal. Okay. Awesome. Thank you. I will just quickly go over my non-transport list. You've been fully assessed, your vital signs are normal, you don't have any serious injury or illness, and there's no red flags present. You're able to mobilise, and you've been verbally and written told what's happening.